Hi, everybody. Welcome to the Coronavirus Task Force. We're meeting today on December 16th, 2020, and what's going to be our last task force meeting of the year, pending something major happens. So I was looking ahead on the calendar. I think this will be our last report because I don't anticipate things changing very much, but if they do change, some new order comes down from the governor, something drastically changes, I'll call the task force back together. But so, like I said, this will be our last meeting before the holidays. As we normally do to start off the task force, I'm going to go to our medical representatives. I see Dr. Frank Busana on the line. Nice to see you, Dr. Frank. Dr. Frank works for comprehensive care, and he gives us the report first. So let's go ahead and get started, Dr. Frank.
So from the medical standpoint, the biggest news is, of course, as I'm sure everybody's seen, the vaccine from Pfizer has been FDA authorized and is being administered currently to healthcare workers. Each state has their own list of priorities and who they classify as being first to be receiving the vaccine. State of Indiana's healthcare workers and high-risk individuals, elderly in nursing homes. I will tell you, you asked me the question, Mayor, if I would receive the vaccine, and I am actually receiving it today at 1:20.
Where are you taking the vaccine at, Dr. Frank?
I am going to community.
Nice.
So I'll let you know how it goes. But you asked me another question on that topic, and I said I wanted to see the data, and I've seen more data on it. And I don't want to get too in depth in it, but it's really amazing what they were able to accomplish with the technology that they're utilizing to do this vaccine. And in very, very simple terms, what they've done is they've taken a small little piece of RNA, an mRNA, messenger RNA, and it almost works the same way the virus works, in that little piece gets into our cells. It basically hijacks our cell to replicate a protein that stimulates the antibody production, and it burns itself out just like a virus would, and it's gone from your cell. It doesn't change your genetic code. It doesn't do anything long term, obviously, that we know of, but the technology, it shouldn't. And it sounds really, really, it's fascinating to me from a scientific standpoint that they were able to come up and not only with the concept, but pull it off.
Do you see any difference between the two vaccines? I mean, right now we have Moderna and we have Pfizer. Does it matter which one you take to you? I mean, or is it just...
No, I don't think so. There's the only real difference that I know of is the method of storage. It doesn't have to be quite as cold for the Moderna, so it's going to be a little easier to get that out into the general population. The Pfizer has to be kept at very sub-zero temperatures, so they're only, the only places you're going to be able to receive it are probably the larger hospitals that have the in-house capability to store it and disperse it. The Moderna will, I suspect, be able to get out into the general population because it only needs general refrigeration, but the actual mechanism of action is exactly the same.
Okay, I appreciate that. You got anything else you want to report?
No, I think everybody's, aware of what's going on. The cases have been surging. I do believe we're on the back end of this whole pandemic, but we still got another 5, months or so, I think, that we're dealing with this.
Do you notice that it seems like the common cold is less severe this year because we're all wearing masks? Is there any truth to that rumor?
I expected the common cold as well as the flu season to be a lot lighter. Because we are doing all of the things that would help reduce the transmission of those diseases as well. So yeah, I expect that to be true.
Yeah, because it seems like I always have, something with my throat or something with my ears or in this time of year. And this year, I've noticed that, I don't feel anything at all. I don't know if it's my head or.
No, I don't think so. I mean, I think you have that, and you also have the flip side where I know for myself, every time I get something like a little congestion or something, I'm like, oh crap, here it is. And,
I got COVID.
I got COVID. And the next morning I wake up and it's fine. It's gone. And I'm like, okay, I guess not. But yeah, no, I expect it to be a lot lighter. And, maybe we'll continue to do some of these things. I don't think mask wearing will be a long-term thing, but the hand washing and just general hygiene.
I wonder about
especially
that. I wonder if a year from now, when everybody's already taken the vaccine, if people will still be wearing masks everywhere. 2 years from now, I have a feeling you will see some people.
Some people will, no doubt about it. I don't think. I don't. My personal opinion, I don't think majority of the people will, but you'll find people that will.
How about in the medical office setting, like in your office? Do you think your nurses will continue wearing masks for a while, or?
No, not well. And as long as there's a mask mandate, whether or not they're vaccinated, obviously we will comply with that. But once that is lifted and people are vaccinated, I'm not going to require it. Honestly, it's a pain in the butt. Anybody that has to wear it all day will tell you it's not fun.
I got you.
There's many people that are not even in the healthcare industry that are doing that, and I'm sure most people can't wait to be done with it.
Cool. All right. Thanks, Doctor. It's great talking to you. Next, I'm going to go to Karen Callahan, Franciscan Health. How you doing, Karen?
Good. Can you guys hear me okay?
Yeah, I could hear you okay.
Okay. Good. The hospital, from a hospital standpoint right now, we are very busy, very full. Kind of like what Doctor just said, there's still that, there's a lot of patients that are still sick. So we still have to do those measures that we feel like we're constantly talking about it, but wear your mask up over your nose, wash your hands, stay away from crowds, social distance, Christmas is coming, stay within your bubble of people, just like you did for Thanksgiving. If you did that, that's really, really important. Right now the ICU is full, the IMCU is full. So that's the 2 step downs, not all COVID patients. There's 8 in ICU. We have plenty of vents, but as we've learned more about this virus, we don't put people on vents as much as we used to. We give them what's called high flow oxygen, or we put a face mask on them. Initially, we were like vent, but now it's less, but there's people that still do need that. 8 COVID patients in the hospital currently right now. There is 19 in-house. There's 20 rule outs, so that means that those 20 could be positive, right? We're waiting for that PCR test to come back. Discharged home year to date, 806. Deceased, unfortunately, 87.
That's that's all year, right?
Correct.
Wow.
Again, we continue to do everything we can do to isolate the sick, waiting rooms, things like that. People are getting used to, they understand. And we're always working on maintaining more negative pressure rooms for the safety of the hospital and the patients. Just a quick
first time. We've been talking a long time. I think this is the first time you told me the ICU's been full. Is that true?
I think back in March it was full. This is not uncommon for the ICU. It's a 20-bed ICU, and there are times when it is full, but you are correct. So if I can press upon anybody in the city of Hammond right now is please do what you're supposed to do. This is a team effort. All the parts of the team needs to work together. So, I still continue out in the public at the grocery store, see people with their mask underneath their nose. You can't do that. Right now, we have to work together, and please wear the mask correctly and use that hand sanitizer. Wash your hands when you get home from the store. Those kind of things are so important. Social distancing, extremely important. And I know people are so tired of hearing about it and they want their normal life, but we have to start learning how to live and make things normal with what we're doing with these processes, the masks, etc.
When do you think, like when you show up to work every day, you have to wear a mask, obviously, right?
100%.
How long do you think that happens? Because that's a new thing. I mean, 2 years ago, if we went to Franciscan, the average worker wasn't really wearing a mask, right?
No, only for certain isolated patients, TB
right.
patients, things like that. Correct.
But
so
like,
it's very.
If I worked in the office, like in human relations, I never had to wear a mask a year ago, and now if I show up to work, I wear a mask all the time, right?
Yeah, absolutely.
How long does that go on for, do you think?
So here's another thing, and I don't think Dr. Masana touched on it. After you get your vaccine, you still need to wear a mask for a certain amount of time. It's a two-part, right? You get a shot, 21 days later, you get the second injection. So you have to wear a mask until your body is creating those antibodies. It takes time. So as long as the mask, and that's going to be governed by the Indiana Department of Health, the government, when we can have these, when there's no mask mandate. So even if you get that vaccine, you have to wear your mask after it. It's not just a free for all and you can take your mask off.
Right.
That's super important for people to remember that. Okay. The vaccine doesn't make you sick. It's not a live attenuated virus. Dr. Masana talked about the DNA. CDC and Indiana State Department of Health has a beautiful website for people that want to know a little bit more about that. Follow those recommendations. If you're pregnant, you should not receive the vaccine. They are saying if you're postpartum, meaning you just had a baby, or if you're breastfeeding, it should be safe, but you need to talk to your physician and you need to talk to your obstetrician in those cases. So that's
you guys are getting the vaccine at Franciscan?
Healthcare workers are our first priority, 100%.
But is that going to be ultimately a place we go, or we're going to be going more like CVS and Walgreens and stuff like that?
So I think the spearhead of this is the Indiana State Department of Health. So I know that healthcare workers are a priority and we are getting the vaccine, like Dr. Masana said. So as time goes on, when they are distributing it to the public, I think we'll hear, I don't have the answer to that right now. Okay. So, the holidays, the CDC and the local health departments have linked spikes to infections of family getting together. So try to limit it like we talked about. Again, the hospital, it's a team effort. I'm trying to look at my notes, I'm sorry. We need that public support because it's taxing on the healthcare workers. You see the commercials, you see the memes, you see the things on social media, nurses, techs, unit clerks, everyone is exhausted from this. So we really need the public's help to help get this to that herd immunity. I think, and then my final thing I always like to talk about is your immunity. Try to decrease your stress. Try to get the appropriate sleep. Try to drink enough fluids. Limit your alcohol, exercise, eat the right foods. I know that sounds so crazy, but vitamin D, 2,000 units daily, zinc, these are things that we need to do to keep building our immunity, because even if this goes away in the next 6 months, year, we never know if we're going to get another virus, right? This has shaken up the world. So we need to make sure that you're building yourself to fight something in the future.
Great. I appreciate it, Karen. It's great to see you. I thank you and Dr. Frank very much. Hey, doctor, want me to come back to you?
It's real quick. I was just going to answer your question on the distribution of the vaccine. It will eventually get to where it is given out just like any other vaccine in a doctor's office, a CVS, a Walgreens. The vaccines that are following these two will not need the significantly cold temperatures, and even the Moderna doesn't. So when it gets to the point where the general population is, eligible to get it, they will have the infrastructure in place with the existing methods that we use to employ vaccines. So that's how it will be done for sure.
And you said you got the vaccine already, right?
Today.
Yeah.
At 1:20, I'm getting it.
Oh,
so,
you're getting it today.
Yeah,
Karen,
I'll let you know.
Karen, did you get yours?
No, but I will. I'm scheduled.
Nice. Good job.
Yeah. Thank you.
All right. So anyway, I want to thank both of you for coming on. I want to recognize Hammond School City Superintendent Scott Miller and thank him for being part of this. And Scott, can you give a report from the school city, please?
Thank you, Mayor. Merry Christmas, everyone.
Merry Christmas.
Just on that conversation, if anybody has any influence, would love to see teachers in that second round of vaccinations and having that availability. I know for Hammond, we have over 800 teachers, and that would go a long way in making them feel safer about coming back into school. So, and any voice anyone could have to that, don't forget about the teachers. What's on everybody's mind is reentry. On the January 5th meeting of our school board, I will be making a recommendation for the spring semester. It wouldn't be right for me to announce anything right here. But I will say that we are very reasonable. We look at the data, we see everything. We're not going to force the doors open if it's not safe overall for our students and staff. So look for a recommendation.
And one thing I heard you speaking about this subject earlier, and one thing that you said that I thought was real important is you're not going to force anybody to come back if they want to continue to e-learn, right? I mean,
100% true. It will be an option for the remainder of this school year for parents to select full-time e-learning no matter what happens. Yes.
So the only quote unquote inconvenience that you could possibly do is say, come back to school normally. And if you don't want to, you still have the option to stay at home.
100%. Yep.
Okay. I think that's important to point out, Scott.
Yeah. And I thank you for mentioning that, Mayor, because that seems to be a rumor out there. I see it on social media and I try to correct it every time I see it, but we've never once considered not allowing that option. We've always said, no matter what, families who feel most comfortable this school year with continuing e-learning will have that option. I
think that's super important to get out there. I appreciate you bringing that up.
Yeah. But so stay tuned for the January 5th meeting, and I'll be making a recommendation to the Board of Trustees. I would not look for an entire second semester type recommendation like we did for the first semester. It'll be a much smaller window of time because we do need to get the kids back, especially the ones, our survey data says almost half of our parents want their kids in school. And I respect that. I respect parents' voice in that because they know that for not all kids, this is the best scenario. A lot of people on this call probably have kids who are doing e-learning, and you know the challenges with e-learning. I have a kindergartner doing e-learning. It is tough. It is not the greatest environment for all learners, and we do need to try to get the schools back open as soon as we safely can.
I agree with you. I have a son, Patrick, who thrives in e-learning, but he has advantages that a lot of kids in our city don't have. Maybe there's 4 kids in only one quiet area where they can do their homework, and they're dealing with that on an everyday basis. So I agree with you, Superintendent Scott. Getting the kids back to school is very important.
And that's it. Thank you very much, Mayor. Thank you, everybody. Merry Christmas.
Thanks, bud. It's good to see you again, Scott. I appreciate you being here. Next, I'd like to go to Hammond's Corporate Counsel, Kevin Smith, to give a summary. Kevin didn't know I was coming to him, but I'm sure right off the top of his head, he can give us a summary of what's going on with the governor's latest order and how that applies to the city of Hammond. Okay.
Good morning, Mayor, and thank you. The governor's most recent order was 20-50. And I guess, first of all, it's amazing we've got 50 executive orders from the governor this year. It's something that I really never even paid attention to, and now we're paying attention to them about every 2 weeks. The importance of this one is that it extends through December 31st is the next deadline. He seems to be doing them almost monthly or about every 3 weeks. So I assume we're going to get another one by the end of the year. From a city basis, and I guess just from an economic basis, a couple things that he did in that order was, and I'll go through just a couple items, Mayor, that I think are important from the city's perspective and for those businesses that might be affected. For bars and restaurants, they went away from a percentage, and by the way, we're in red, okay? I think everywhere in Northwest Indiana is in red. It's color-coded now, so, and it'll remain in red for at least another 2 weeks because you can't get out of it for 2 weeks once your numbers come in. In red, and for restaurants, bars, taverns, nightclubs, other establishments providing in-person food and drink, they're off of a percentage. So in other words, it's not 25% capacity or 50% capacity anymore. What the rules are is, number one, you have to remain seated while you're there and you're consuming food or drink. If you have to get up, like to go to the bathroom or to enter or exit, have to have a mask on. Secondly, even though there's not a percentage, even though there's not a percentage of people in a certain place, what they did say is that you have to keep 6 feet distance. So the tables have to be arranged for 6 feet of distance. So that's the other important thing. If you have a restaurant or run a restaurant or in a restaurant, those are the rules they're supposed to be following. They're also allowing, even though it's not recommended, buffets and salad bars, but only if the food is served by a staff member and not self-serve. The other thing to remember is, and this comes up, and I'm sure the mayor is going to probably ask Jim Talon at some point to give an update on the Sportsplex. But I know that there's been comments made, oh, you know, the parking lot's packed or this or that. The truth of the matter is that, number one, the governor's order allows for community recreational sports leagues and tournaments to continue. However, it limits attendance to participants, required personnel, and parents of the minor children. I know at the Sportsplex, they only allow one child in, so that's more restrictive, which is, of course, allowed by the governor's orders for the mayor to impose closer restrictions. Also, that social distancing is required. And I would just note, as far as the Sportsplex is concerned, it's a big place, and you may think that the parking lot looks packed, but the truth is, if you go inside, I know that Jim Talon and Kim Roberts and their staff is working very hard to keep the protocol in place. And it also, the governor's order also requires that anybody that runs a facility has to maintain proper staff. And so I know the mayor's been very clear to his department heads that if there are events going on that comply with the governor's orders, that they do have appropriate staff. And one last thing, Mayor, the governor mentioned that there are no exceptions you can't submit a safety plan going forward with the county health department. So we're going only by the governor's orders, and that's what you even told us to do.
Okay, I appreciate it, Kevin. I have heard people complain about the Sportsplex. We've had two events that we had approved by the Lake County Health Department. The Christmas tree lighting ceremony, which was very safe, outdoors, social distancing, everybody is wearing a mask. The Hammond Christmas parade, which was outside, everybody participating was wearing a mask. I mean, social distancing. I mean, what I saw was mostly families staying together, but they were outdoors. And then the Sportsplex has an exemption from the health department as long as we maintain social distancing, which we've been doing. So anyway, I sort of, you know, I'm as long as the governor doesn't go more strict, I think we're sort of in a sweet spot. We're trying to balance safety and commerce, and that's what we're trying to do. And, you know, if the governor doesn't think we're being safe, he's going to tell us, and we're going to react accordingly. If the Lake County Health Department doesn't think we're playing it safe, they're going to tell us, and we'll react accordingly. So that's where I'm coming from anyway. I see Scott Wells. I believe, Scott, you're from the Hammond Baptist Church, right?
The gate over here on.
Yes, sir. Nice to see you, Scott. Sorry, thanks for being on. You want to give a report to the committee?
Yeah, just we're a lot about outreach. So we run the Claude Street Shelter, and we do a food pantry each week, you know, and we're doing all drive-through to keep everybody safe. All our volunteers are wearing masks, so, you know, social distance as much as we can, and hand sanitizer and all that. But we also do a community meal on Saturdays. So we've just been continuing to do outreach. We just had a huge event this past Saturday. We did a gift giveaway, which blew up in a sense of drive-through. We filled our parking lot. We filled some of the street, and then we had to go to Erie Career Center parking lot and just run people through. Thank you to the Hammond Police Department, because they came over, just asked what we were doing, and said, "Oh, you're having an incredible event." So we probably about 159 cars come through, and we gave out gifts to the kids and hot meal, turkey dinner with all the trimmings. So just right over here on Soul Street, you know, and we've been just trying to meet the community needs as much as we can.
Thank you for what you're doing, Scott. And thank you very much to the gate. And, you know, we appreciate everything you do for our city.
Yeah, thank you.
Thank you for being on. I skipped Jim Talon of the Hammond Park Department. Jim is superintendent of parks. We talked already a little bit about the Sportsplex, and I know Kim, the superintendent of the CEO of the Sportsplex, is doing a real good job monitoring what's going on in there, Jim. But I also noticed you put signs around the city parks reminding the people that are using the parks of the capacity limits of the governor's order, correct?
Yes, sir. We did put those out. We talked about it a couple meetings back. So those are now in the parks, reminding people that no gatherings of over 25 people in the parks.
Good. And then is there anything else from the park department? I'm going to kick over to Andy Short, the assistant chief of police, and ask him if they're enforcing them. But is there anything else you would like to report from the park department? How's the Shepherd Center and the Civic Center? And I imagine their Civic Center is not as busy as usual, obviously.
Right, correct. I mean, we do have some weekends where if there's a bigger tournament at the Sportsplex, we will utilize both of those facilities for some teams to play there just to keep the numbers down at the Sportsplex. And I think Kevin touched on a lot of, we are doing everything. We have a safety plan at the Sportsplex, and they are doing a good job of enforcing those plans.
Okay. All right. Well, can I go over to Chief Short, Hammond Police Department? How you doing, Andy?
I'm good. Can you hear me?
Yes, sir. I can hear you.
Okay. How you doing?
Good.
As far as the parks, I know that we have enforcing it, but
Hey, Andy, push your computer back a little bit. I can't see your face. Look at you, man. You're handsome. I want to see your whole face. So.
Yeah, as far as the parks, because of the cold weather, it's been helping us. But if we will see something, we will then enforce the governor's order of 25. I drove by quite a bit of them yesterday, and it's not bad at all.
Right. So, like, if you see like a basketball game going on, we're not going to break it up, right? I mean, because it's outdoors and it's less than 25, right?
Right. We'll just chances are some of my guys might even go over there and just talk to the guys, but no, we're not going to break it up.
Like skateboard park, I guess, could get busy, right? You know, places like that.
I was there yesterday, and by the time I drove all the way around the park, some of the kids were just leaving, so they know.
Right.
You know, it's not a problem.
Right. Okay. Anything else from the Hammond Police Department you want to report, Andy?
We had a surge of quite a bit of guys that got tested positive, but for the last 2 weeks, it's been extremely quiet. So whatever we're doing is working right now.
Right.
We can't wait to get the vaccination in regards to our first responders, our first class patrolmen, all of our patrolmen, really. So
Are you scheduled to take yours yet?
Huh?
Are you scheduled to take yours yet?
We haven't heard anything yet.
Yeah. I know, Kevin, you said you were.
I'm scheduled for Friday morning.
Kevin Margraf scheduled for Friday morning, so obviously fire department's getting prioritized over you in the police department, Andy.
You know, that happens all the time, you know?
All right. Thanks, Chief. I appreciate it. Thanks for the report from the Hammond Police Department. I want to next kick it over to Hammond City Council. I see a few council members out there. I'm not sure which one wants to step forward or if all of them do. I see Scott unmuted himself. Scott, you want to give a report from your seat in the 6th District?
Sure. As far as the council, there's not a whole lot to report. I can tell you, though, we used to have almost half and half going on council meetings going to on scene and then on Zoom. I think there was only one person on scene yesterday. Some of us older ones have a harder time with the technology, but it seems like we're all starting to get it now. And I want to shout out to the IT department because they're doing a really good job, and we've all learned how to do it that way, and it's the safest way to do it. So
that was the weirdest council member ever. I was in the audience yesterday on Monday, and Councilman Torres was sitting there, and the rest of the council was on a TV screen. Never seen anything like it.
Yep.
Yeah.
That I've been doing that for quite some time. I just think it's better for me, and I've learned how to use Zoom. I know Barry and Katrina, they got no problem with Zoom. They got it right away. Some of the rest of us, it took a little longer to get it. But
yeah, I know when Barry does it, he'll have like the Golden Gate Bridge in the background and stuff like that, which tells me he's got a better Zoom game than I do. So.
Oh yeah, I finally got a way to put my picture on Zoom now when I'm off camera. So that was a big deal for me.
All right, thanks, Scott. I'm going to kick it over to Barry now and see if Barry wants to say, hey, how you doing, Councilman Tyler?
I'm good, Mayor. Thanks. No update for me. The only thing I'll share is that we do have our capital improvement board meeting on Monday, which of course will be via Zoom or in person as well. So if members of the public want to attend, they can join either way.
Okay. Anybody else on the Hammond Council want to report? I don't see any other council people. Is Katrina out there? I know she attends our meetings a lot. Don't see her. Anybody else need something to report to the coronavirus task force? Unmute yourself now. Okay. I appreciate you guys and all the help that you're giving. A lot of Hammond residents, thousands of people watch this video every time we do it. So I appreciate you participating in this. Since the next 2 weeks are holidays, I figured our next meeting would be 3 weeks from today. hopefully we're checking in and the numbers are going in the right direction and people are getting vaccinated the next time we get together. If some emergency happens where I think it's necessary to call us all together, we'll reach out by email and put it back together, okay? Other than that, I'll see you all in 3 weeks. Happy holiday to everybody. Continue to practice safe social distancing in your gatherings, and I will see you in 3 weeks. And by the way, to Lori, the interpreter, thank you very much. It's good to see you, and we appreciate your help as well. Thank you, everybody. Happy holidays, Merry Christmas, Happy Hanukkah, stay safe.
Merry Christmas.
Thank you.
Christmas, happy holidays.